And so as the number of coronavirus cases are on the rise, the Indian Council of Medical Research has revised its testing strategy. Now, this is a big development, as the revised guidelines include sample testing of all direct and high-risk contacts of COVID-19 positive patients. Now, the contacts will now be tested once between day 5 and day 14 of coming in contact with the patients. The direct and high-risk contacts include those who live in the same household with a confirmed case. It includes healthcare workers who have examined COVID-19 positive patients without proper protective gear. So far, those with symptoms were allowed to get tested. Now, those with severe acute respiratory illnesses like pneumonia, with fever, cough and breathlessness will also be tested. Now, let's also gauge the situation in India and review where we are actually standing as of now. For that, I'm joined in by Professor Ramanan Lakshminarayan, Director at Centre of Disease Dynamic Economic and Policy and the founder of HealthCube. Now, Professor is also joining us for a second time. Professor, a very warm welcome to you. Now, if you may recall, the last time we spoke, we talked about how the criterion for testing of coronavirus needs to be broadened, and that has just been done today, as I pointed out. So far, only those with symptoms were allowed to get tested. How will this change now impact the existing scenario in terms of figures?
So this is a welcome change. It's probably about 2 or 3 weeks overdue, but I'm glad it's happening now. And what we should be prepared for, to be quite honest, is that we will see an increase in the number of cases, and we should not panic. We should know that these cases are always there, but now we are picking them up when we test people. So I would expect that our caseload will go up significantly at this point in time. But again, that is reason to take it seriously and not to panic. Now, beyond this, I think the expansion should also happen into private labs, because the government lab setup simply does not have the capacity to be able to take on this expanded criteria. I know that the private lab plan has been in place for some time now, and I urge ICMR to go ahead and involve the private labs and also other government labs, not part of the ICMR network, whoever has not been involved, to get everybody on board. We need all hands on deck right now to carry out this testing plan.
All right, fair enough. Involving private players is something even WION has been constantly emphasizing. Now, the case of a 20-year-old man tested positive in Tamil Nadu, which has been reported in the papers today, and now this case did not have any travel history abroad. This has already set an alarm as India's first case of community transmission. Has community transmission in India already begun?
So as I've said now many times over, community transmission in India probably started 3 weeks ago. This is not the first case of primary, community transmission. It is the first case that has come to the notice of the authorities. But community transmission, as any physician working in this community will tell you, has already started many weeks ago, and there are probably tens of thousands, if not at this point, hundreds of thousands of cases already out there. So let's catch up, let's give the public the real numbers, and then let's try to enforce the distancing that we're trying to get people to do.
Happy that you emphasized on the fact about how the public needs to be given the real numbers. And so the number of confirmed COVID-19 cases has, of course, risen to over 279 in India. This is the reported figure. And yet it marks the highest single-day jump in the number of cases yesterday. And going by the trajectory witnessed in China, Italy and Spain, how do you view the caseload in India?
So the caseload, as I just mentioned, was already probably, numbers of infections. Keep in mind, we count numbers of infections, but most of the people who are infected, more than 80%, will just have a mild cough or a fever. They won't even know they've had the infection. So it's very mild. It's only about 1 in 10 or, 1 in 15, somewhere in that number that will have really severe cases that they'll have to be hospitalized or seek medical attention.
Right.
And we will see that number going up in the coming days.
All right, Professor, so